Hello, my name is Jessica Aizawa. Today I'm here at Tokyo Medical University of Hachioji Medical Center, located in Takao, Tokyo, to help Dr. Toshiya Nishibe, vascular surgeon at this hospital, to demonstrate some important techniques. So let's hear from Dr. Nishibe about a simple method for detecting peripheral artery disease, or PAD for short. Hello, good to meet you, Dr. Nishibe. Good to meet you too. So, doctor, what is PAD? PAD is a leg disease that is often found among patients with diabetes, high blood pressure, and hypercholesterolemia. However, you should never underestimate PAD because it's not just a leg disease. The 5-year survival rate for PAD patients is 75%, which almost equals that for colorectal cancer patients, so you can understand how serious a disease PAD is. Are there many PAD patients today? Statistics show that around 18% of diabetes patients have PAD. The number of diabetes patients has been increasing recently, and around 22 million Japanese, almost 17% of the total population, now have diabetes. Similarly, the number of Chinese diabetes patients is estimated to be 92.4 million, which is 7% of its population. These figures suggest that more than 4 million people in Japan and 16 million in China have PAD. These are huge numbers. Yes, but many patients consider PAD as just a minor leg disease and do not see their doctor for treatment. Unfortunately, this is a big problem for PAD patients. There's a simple but important thing we can do. I'm now going to tell you about a simple screening method to detect PAD. Firstly, examine whether the patient has any numbness, cold sensation, or pain in their legs. Okay, please take off your socks. I am going to check the condition of the patient's feet and then palpate the dorsalis pedis artery. Examine and make sure that the pulse is strong. Next, palpate the posterior tibial artery, making sure that the pulse is strong again. Although it is best for all diabetes patients to get a PAD examination, the examination itself is difficult and not all hospitals have the necessary instrument for detecting PAD. Still, I believe that doctors must at least interview and check their patients' legs, especially the feet. And if they find any abnormality of the pulse, or if they suspect PAD, then perform a more detailed palpation on the feet as well as on other parts of the body. The full palpation examination is performed on 4 parts of the body. Have your patient take off their outfit, such as trousers and skirts, and lie them down the bed. Start from the patient's thigh. Palpate with 3 fingers to examine the femoral artery. Secondly, palpate the back of the knee with both hands, searching the popliteal artery. Next, palpate the dorsalis pedis artery. Followed by the posterior tibial artery. If you feel the pulse is weak, or if you feel no pulse, then you should suspect PAD. If you feel some noise in the pulse, it may suggest a narrowing of the vessel. In that case, you should also perform auscultation. Actually, a more precise method than palpation of detecting PAD is ABI, or ankle brachial pressure. ABI measurement is very simple and effective for PAD screening. and can be easily achieved using automatic instrument that measures ABI by the blood pressure of both arm and leg at the same time. An ABI of less than 0.9 is considered to be abnormal and enables a diagnosis of PAD. But today, I'm going to introduce the easier measurement method using a Doppler stethoscope. But we must be very careful before confirming a patient is fine because some patients with diabetes do not show any abnormal ABI when their artery has already become too hard. In those cases, you should perform SPP, skin perfusion pressure, by pressuring the feet skin to check the ischemic condition. To improve the short and long-term prognosis of patients with PAD, early detection and optimal treatment is critical. We need to do this because PAD remains one of the most underdiagnosed diseases of all CVD. In most cases, the presence of PAD is clarified by medical history and physical examination, including palpation of arterial pulses and measurement of ABI, without using any special medical appliances. So it is vital to start screening your at-risk patients using these methods. We can also make a significant difference by helping to modify patient risk factors.